Sex is an important part in human's life, and everyone wants to be satisfied when having sex. And today we're going to investigate what is an ideal sex for people, especially in Asia. 2010 Ideal Sex in Asia survey aimed at finding out what is an ideal sex for Asian people and how to achieve it. There were 3,282 respondents, 1,658 men and 1,624 women from 10 countries in Asia participated in this study. The survey found that 79% of men and 80% of women in Asia agree that erection hardness, or the ability to maintain an erection, is the most important element of an ideal sex. Orgasm intensity and frequency of sexual intercourse come at the second and the third place respectively. In summary, it's about the quality of sex, not the quantity. However, the survey also shows that more than half of men in Asia Pacific admit they have an erection hardness below standard, which means they are likely to suffer from erectile dysfunction. Erectile dysfunction is the inability to attain and/or maintain a penile erection sufficient for mutually satisfying sexual performance, with symptoms occurring regularly or continually.
We recognize that there are quite a significant number of men and their partners actually recognize that the men suffers from EHS 3 and below, i.e. they suffer from erectile dysfunction. EHS stands for Erectile Hardness Score. We would just measure what is normal is number 4, and what is not normal is, or suboptimal, is 3, 2 and 1. So from that study, we previously recognized that about 40% of men in Asian countries suffers from erectile dysfunction, and out of that, majority of them are quite mild. We call EHS 3. It's that's a way to actually describe a suboptimal erection, so that men's ego are not hurt whenever you describe this as suboptimal.
To classify whether a man suffers from erectile dysfunction or not, Erection Hardness Score, or EHS, is used. It divides the level of hardness of men's penis into 4-point score, which are severe, moderate, suboptimal erection, and optimal erection. The doctor makes it easier for men to determine by comparing it with some kind of food ingredients.
So we make it simple. We make it into this scale of actually recognizing whether they have got this condition or not. If they think that hardness is not an issue, like for example, their hardness is as rigid as a cucumber, for example, actually is EHS 4. For somebody who has got hardness that is achieving like a unpeeled bananas, that is slightly soft but reasonable, which is EHS 3. Somebody who has got peeled bananas kind of texture is probably EHS 2, and somebody who's as soft as tofu, you have to be worried because they actually suffers from EHS 1, which is more serious form of erectile dysfunction. So this is a prop that we commonly ask patients to use because some patients are a little bit embarrassed. So whenever you reduce taboo when it comes to describing whether they have got erectile dysfunction or not, this will be compared with different texture or rigidity of food that we can use.
The causes of erectile dysfunction for men are associated with physical and mental health, such as cardiovascular disease, high blood pressure, or high blood cholesterol. It could happen as a result of medical conditions, drug therapy, or major surgery. It may be related with depression, loss of self-esteem, and self-confidence problem as well. The real problems are that many men aren't aware they have a problem, and they normally feel uncomfortable taking it to a doctor, mostly because of embarrassment.
First, you have to know that erectile dysfunction is not an embarrassment situation. Every man face that. It's just that when you get older, the function not to be as perfect as when you are young. Men who have this problem should know that this is not embarrassment issue. It's just the issue of health.
Erectile dysfunction is not a deadly disease. It can be cured by several treatments from professionals, such as medications, analyzing risk factors, and urging men to take care of themselves.
Effectively, there are several treatment strategies. I mean, one of the ways to quick fix, which is our modern day lifestyle way of doing this, is medications. I think that the medications for ED has been around for more than a decade, and it's very efficacious and it's got low side effect profile. And that's the best thing, that we actually need to break the cycle of self-confidence into their relationship. So we improve the EHS3 to EHS4 with efficacy rate of about 80%. And I think that's the first thing that I would do when a patient or their couples come to see me. The next things I would like to do actually is to recognize whether there's any risk factors, because a lot of these men suffers from other conditions such as diabetes, cholesterol, smoking, high blood pressure. We know those are predisposing factors to heart conditions like heart attack. So I will seize the opportunity and try to see whether they can have stress tests, whether they can have ECG, in order to identify who are at risk of getting heart conditions. Because I think as a urologist, as a clinicians, we all have the responsibility in order to identify these risk factors. Once we actually dealt with the treatment and also the identify any risk factors, usually it's a long haul from there, because if we only deal with the current snapshot of the problems, there is a potential deteriorations of the problems in the future. So what we try to encourage is a long haul marathon of health awareness. So we would like them to stop smoking if possible, to control on their diet, to exercise regularly, and to involve their partners in this whole experience. And therefore they can, for a long term, having a good physical health and a good sexual health.
The role of the partner is extremely important in this case, because open up communication with partners and recognize that perhaps men may suffer from erectile dysfunction is the key of finding better health and better ideal relationship. Ladies, you can be a crucial part in helping your man improve his sexual health. Remember, it always takes two to tango. Aravitang Misang reporting for ASEAN TV.